Thank you so much for joining us for the fourth day of the HS Awareness Virtual Summit. I know that a lot of people have been waiting to hear from Dr. Hamzavi. You had the most tickets sold. So people really want to hear from you.
I am so lucky to be here.
Yes.
Wonderful people.
Dr. Hamzavi is not only a dermatologist, but he's an HS specialist. I met him over a decade ago, and he's been my dermatologist since then. He specializes in the treatment of pigmentary disorders and HS. Dr. Hamzavi is an active clinical researcher and investigates causes and treatments for vitiligo, HS, photomedicine, and other conditions. Not only does he own Hamzavi Dermatology, a private practice in Michigan, he too is the president of the HS Foundation and a clinician at the HS Clinic in Henry Ford Hospital. Thank you and welcome to this wonderful discussion. I'm going to allow you to kind of tell our attendees more about who you are and what you do.
Well, Jasmine, it's so nice to see you. So I would do anything for Jasmine. So she asked, we always make it happen. And I guess I'm trying to be a servant to the HS community because I've learned so much from the patients who have HS in my own journey on this planet. And so what we do at Henry Ford Hospital is about 15, 20 years ago, Dr. Diane Jackson and Henry Lim at the hospital wanted to set up a multicultural dermatology center, and just to recognize that, yes, you know, we're equal, but there's also diversity in our populations, and how do we improve the areas of treatment and research in populations that don't always get the best care. And so, so during those times, we were seeing patients who had HS, and they kept telling us a rare disorder, but we have an active photomedicine unit, so we were trying to use light to treat patients with HS, and suddenly we started getting all these specialty patients, and then you start realizing this isn't a small disease, it's a significant disease, and then all the things that the book told you that, you know, it tends to hit European Americans more, it tends to hit males more, were wrong. And it's a disease actually of a little bit more women. It hits people of color a little bit more, and there's so many other things that are tied to it, and every theme in medicine, whether it's the use of antimicrobials, antibiotics, diet, surgery, social impact of these diseases, it gets rolled into HS. And so I'm very proud of my city and my hospital system and my clinics to support patients with HS, and we've never shrunk away from the challenges. But it's, as you know, Jasmine, it's not an easy journey, but it's a fulfilling journey, it's a meaningful journey, and we're just so blessed to know our HS patients. Every day, when it gets very hard for us, we're like, well, you know, there's people who put a smile on our faces who have gone through a lot. So let's go back and have HS friends. Mm-hmm. And we come back and get a little invigorated. And I'm also so excited to share some of the new updates that are happening, and how this movement is building. And so many people are helping out. This is HS Awareness Week, and the HS Foundation, which, you know, as you mentioned, I'm on the board and the president of, is doing a lot of social media. And we're trying to keep up with Jasmine and all the work that she's doing. And we're also very excited to support her work with their documentary work and telling the story. But I'm very excited to be here because I think storytellers actually inspire our society to support patients who have these conditions. And also society benefits from learning your story because there's a resilience to the human soul that's expressed in HS patients that we love seeing. And so we can talk about clinical trials, we can talk about diet, we can talk about surgery, we can talk about how families cope with HS. We can talk about the really, really heart-wrenching stories of HS. We can talk about the successes. But this is your time. Whatever you guys want to cover, we'll cover that today. And I'm looking forward to engaging with you guys.
Absolutely. Thank you for mentioning that too. I do want to mention, I want to thank our sponsors really quickly. Of course, the HS Foundation, the Mama IU. We also have Forward Cosmetics and then Hydra Wear Solutions. Thank you so much for sponsoring this event because without you, we wouldn't be able to move forward. So I thank you so much from everything from giveaway donations to monetary donations. We really appreciate you. I do want to mention that we're going to leave 15 minutes at the end, attendees, to ask questions to Dr. Hamzavi. So if you have any questions, just kind of like our other sessions, please type them in the Q&A, and feel free to chat amongst yourselves in the chat bubble, and we'll try to converse with you as well. So we're going to speak on understanding your diagnosis. We've been talking about what HS is, and I think it's great to hear it from a dermatologist in your perspective, because we asked Dr. Erin Martinez from her perspective and how she explains what HS is, but from a clinical perspective, can you help define and break down what HS is and the different stages that patients go through?
Sure. So sometimes people want an exact answer of what a disease is, and we can't really tell you what HS is as far as why it happens, but we can describe it. So HS is recurrent boils in the folds of the body, underarms, below the breast, sometimes in between the breast, groin folds, buttocks. And the boils are symmetric, they're on both sides. If you have symmetric boils that keep happening, that's probably HS. HS tends to occur a little bit more in women. Boys and girls have the same rates of HS until they hit puberty, then women get more, and about 2/3 of patients are women. HS tends to affect patients of color a little bit more, but there's a large population of different skin types. There's also association with autoimmune diseases that we see with HS. So the way I explain HS to my patients is that there's 3 things that we know about that are problematic with HS. Number 1, there's something going on with the hair follicle and the skin around it. The way the hair follicle forms is there's some kind of defect there. It may be that there's microperforations, there's tiny little holes in the lining of the hair follicle that allows bacteria to get trapped in these holes. These bacteria are called commensal bacteria. They're normally found in all of our skin, but they very rarely cause a problem. So they're not pathologic bacteria, and that's why HS is not infectious. Bacteria is related, but it's not infectious. So that means you cannot give HS to somebody who you love or you care for. Now, you have the defect in the hair follicle somewhere around the basement membrane zone, something going on with the way the skin cells function. And then you have this defect where the normal bacteria are getting trapped in those systems. And then you get this 3rd phase, which is an autoimmune phenomenon, where the programming of the immune system flips. Because we are 9 to 10 pounds, viruses, bacteria, fungi. It's not a great look. You don't want to say to your first date that I'm 9 to 10 pounds of bacteria and viruses, won't get you too many more dates. But that's the reality of what we are. And those things are critical to the way we function. Well, when you react to those bacteria and viruses and fungi in a way that's not sensical to your normal existence, that's when you get autoimmune diseases. So you got 3 targets: defects in the hair follicle, you've got problems with the way you react to normal bacteria, and you have autoimmune diseases. Now, those 3 elements are the 3 targets of treatment in HS. So you have the clinical features we talked about earlier, boils, recurrent in the symmetric locations. You have these 3 potential triggers. And so what can you do to modify those? And that's what we kind of talk about. Now, why is all this happening? We don't have a uniform theory to explain all of HS, but these theories are coming around, but we very much know that the immune system is a key target of HS. Antibiotics are also helpful indirectly, because when you reduce the bacterial load, you tend to improve the immune system. Diet has a tremendous role to play within the immune system. The challenge is that we are starting to have a way of understanding HS. We're slowly developing treatment options, but we don't have every treatment option mapped out, but we're doing that over time. The other thing about HS from a social perspective is HS is not a death sentence. I had a young African-American man reach out to me today, and he was so nervous that he was going to get HS all over his body. And there's a lot of anxiety, and it was one of those conversations where we just had to have a general conversation saying, look, yes, you might get in other locations, but we can manage it. We are much better at managing HS today than we were 10 years ago. When Jasmine was a young lady, when she first came to us, we were still in experimental phase, and we're still in experimental phase, but we have a whole menu of options. So HS is not a death sentence. It doesn't mean that your life is going to be over, but it can be a challenging disease. Now, there's 3 phases of HS in each location we talked about. The first phase is nodules. You have individual bumps, large acne-type pimples, like the worst acne lesion you can imagine. Now, when those 2 nodules connect, you call that a fistula or a sinus tract. That's called stage 2. So stage 1, nodules. Stage 2, they're connected underneath the skin. You have a sinus tract. Stage 3 is when the nodules and the sinus tracts form intersecting areas. So nodules, sinus tract, and then you got them in cross sections. Now you can have stage 3 HS in an underarm and stage 1 in your groin. There's also other scoring systems that are coming up. There's a thing called the high score, which measures how active your HS is, how many new nodules you're getting. And there's another one called IHS4, which measures how actively you're draining nodules or sinus tracts. And then you have patient-reported outcomes. How much is the HS affecting people? And we're measuring that. Because in HS, most people do not die of HS, but it makes their life so miserable and so difficult that we have to measure the quality of life. And so those are some general ideas, the 3 triggers of HS. How do you diagnose HS? Who gets HS a little bit more than everybody else? And then you have the 3 ways of understanding the different treatments. Everything will target around the hair follicle, around the bacteria, or the immune system. And there's different ways to target that. So that's kind of an overview of what I offer my patients when I speak to them. It may be a little simplistic for some of the deep researchers in our group. It might be overly scientific to others, but that's kind of the way I view it.
Mm-hmm. That was great. I think that leads me to my next question. You mentioned the anxiety that patients have when they might have stage 3 in one area and stage 1 in another. One of the questions that we got yesterday was, can you catch HS early before it spreads? So like say if when I was in high school and if I only had one nodule instead of my whole body being affected, would there have been, if there would have been intervention ahead of time, would the HS not have progressed as fast?
So to answer the question simply, we don't know. And to answer it in a complex fashion, we're slowly figuring it out. So starting out, we don't know, but we're figuring it out. And the reason why I say that is that there's a natural course of a disease. You have cancer and you see what happens. Not everybody dies of cancer. A large percentage of people do, but not everybody dies. Strep throat, not everybody will get incredibly sick with strep throat, but some people do. So everything in medicine is based on a probability. So we don't have that progression of saying, well, you stage 1, you go to stage 2, then you go to stage 3. It doesn't work like that. In cancer, we're used to those stages, and so we're scared of a lesion on our shoulder or a lesion on our lung, and it might grow somewhere else. It just doesn't totally work like that. Now, we are slowly trying to figure out who will progress, and we are getting different measurements of those. So HS that is rapid onset, that is rapidly draining, that's probably going to progress. HS associated with other comorbidities such as high body mass index, hypertension, type 2 diabetes will probably progress. Families with HS who tend to get severe acne and scalp lesions may progress. And those are some of the variables we're coming up with, but we are plugging that into large data. And there's some really good initiatives going on with the foundation as well as other institutions throughout the country and the world, which are collecting registries. Once we have the natural course of HS, we can figure out what are the variables, either by history, by examination, by ultrasound, by blood test, to say, okay, this person has a type that's going to progress. However, given that context, there's another anxiety part, and that is, can you manage my pain? If my lesions are progressing, can you do something about it? Yes, absolutely, we can. And we have this thing called step therapy. We try this, then this, then this. And we go with more aggressive therapies based on how people are doing. So the other question is, if I get to the advanced state, can you pull me back? We can in many instances nowadays. Not in everybody, but we can. So to answer your first question, we don't really know who's going to progress, but we're learning. The second question is, can we bring you back if you end up into an acute flare and becoming into a stage 3 disease state? Yes, we can. But I can't predict who's going to get stage 3, who's going to stay at stage 1.
Mm-hmm. And I think that brings up another important question. A patient was asking yesterday some of the symptoms that you experience before a lesion comes, or how do individuals know if they are going to get HS? One of them asked about itchy skin. So in an area that's bare and does not have any HS nodules or tracts or anything like that, does that area, is that more likely to get a nodule if it's itchy skin in that space?
There's often a prodrome, is a medical term for that, before you develop HS lesions. And Dr. Amit Garg and his historic group, that's part of IDIOM, also affiliated with the foundation, has done a lot of work on asking patients, what happens to you before you get a nodule? Pain, itching, drainage are things that happen. Most people describe a swelling, like, they feel something's coming around, they have a reduction in movement, and then some people describe an acute pain. A minority, probably less than a third, describe itching as an area, but the longer the HS goes, the more itching becomes a dominant variable. But all 3 of those are things that can precede the onset of HS. A small percentage of people feel systemically unwell. They start shaking, they have fevers, they have chills. That's a minority, but it does happen. And then a small minority still has low back pain and severe arthritis before the HS flares up. but most people have a sense that they're going to get a flare up.
Mhm. And so you were talking about how antibiotics can help with reducing some of the bacterial load. I've read some, or I've talked to some naturopathic physicians who talk about gut health and how antibiotics can really, they don't only kill the bad bacteria, but it kills the good bacteria. And a prolonged use of antibiotics can actually affect the whole body negatively. Can you speak to that and just kind of clarify what you understand about prolonged use of antibiotics?
So, so the first off is that criticism of the medical system and physicians and researchers and mid-levels is critical. So you have to be able to share what your positive and negative experiences are. So what we know today is that you're absolutely correct. Long-term antibiotic use, and it's long-term, does have significant effects on gut health. But we also have to ask, what does that mean? And so if you talk about the worst effect on gut health that we can measure in traditional allopathic medicine is there's a condition called C. diff. It's a Clostridium difficile. It's a type of bacteria. And that bacteria overgrows when you kill good bacteria, and you get the severe diarrhea. And we don't see any higher rates of C. diff in HS patients in the general population. Now, the other question is, does gut motility, does gut health impact the overall immune system? It does. When you look at the rheumatoid arthritis literature, when you look at recent vitiligo work, they're able to show that when you use certain antibiotics, you are able to change the presentation of bacteria, and it makes the immune system develop these cells called memory T cells. Memory T cells are part of the reason why HS seems to occur in certain locations. Always the underarms. Why is it always the same spot? Why is it always the same portion of my buttock? Why is it always the same portion of my breast? Those are the memory T cells that occur that might be related to the way the gut health presents the environment to your immune system. However, the question then is, what do you do with this? What do you do with this? So when you do HS work, you have to look at C. diff and how often it happens. You have to look at the progression based on gut health. But what do you do to change it, and does it make a difference? And in the traditional form of medicine, we can do animal studies, we can do cell line studies, but we have to do the clinical studies. And so there's very few well done, fully funded studies looking at gut health and how to improve HS. Now, the foundation in our meeting in Detroit this past year, that was the first thing we asked for. We really need studies. Now, if the diet doesn't work, we want to know about it. But at the very least, we have to have the studies. But our system is very much based on symptoms. So our system of medicine is based upon, you're hurting from your HS, let's give you medicine, let's see what happens. So antibiotics are a great example of that. We don't have this type of study design that allows us to decide, okay, this diet helps with HS. That being said, when we look at inflammatory markers, we do know that certain foods make HS worse as far as an inflammatory state. High carbohydrate foods seem to make it worse. Those may have baker's yeast or not. Foods that have a high carbohydrate load may also make that worse, which is kind of similar to the earlier category. So generally, breads, yeast-based products, the sugars in pop or soda, as you guys call it in California, pasta and those elements. And the other thing we find is that HS patients have a much higher rate of type 2 diabetes and metabolic problems, which is related to food. So there's definitely enough to say diet's a factor, but how do you manipulate diet to help the overall state of health of that patient? We're still working that out. And I'm open to learning from others, but I don't think that anybody can have definitive studies saying this works, and that takes time. But we're pushing on it because so many patients describe improvement. And you talk to the patient community, 2/3 of HS patients, I think that's the number to check that, are convinced that diet has an impact on their disease state. And I don't discount that, but can I measure it to manipulate to help my patients a little bit with the foods I just mentioned? The other things by the keto diet and the paleo diet and all the other things, we don't have as much data, but we're working on it.
I remember when I first met you, you suggested, you didn't directly say, but you suggested that maybe changing the time that I eat during the day, or just watching sort of like some of the, food and sugar intake might help. And that kind of influenced my path to becoming a vegan and like really going full-fledged. And it actually was beneficial for me. Now it's a little bit more complicated, but yeah, it's definitely different for every patient. And I know that in the documentary, we discuss sort of you've had patients who have tried veganism and they've gotten worse, but you've had other patients who have tried it and gotten significantly better. So that's something that's interesting that patients kind of have to decide for themselves whether they want to involve themselves with or not.
Well, I think that's understanding your body, and I think that's also the nature of medicine. You know, when we give you a recommendation, it's based on maybe hundreds, thousands, maybe millions of people, but that's an aggregate. But you are you. And when we first met, I was a little worried because you had developed a little bit of a band of discoloration in the back of your neck, and I was very worried you're going to develop type 2 diabetes. And in our population, 55% of our HS patients develop type 2 diabetes or some form of metabolic syndrome within 5 to 10 years. So we're just very careful of that diet connection. But then you have to kind of learn how to use it in your own sense. And you've been, incredible about doing that. The reason why I'm careful about diet is because I have so many patients who have tried the extreme diets and they still have HS. But they've also tried antibiotics, they've also tried laser, they've had surgery, but every little bit adds to it. But diet to get you to maximum health, where you're managing your body weight, managing your blood sugars, managing your blood pressure, very important. Then the deep, detailed diet, they probably have a role to play, but you have to try it yourself without compromising overall health. And you've done a wonderful job. And I think the documentary walks people through that. But you also show in the documentary, despite an optimal diet, which you have, I dream of your diet. In fact, I would love to get your numbers, give it to my doctor to tell him this is my numbers, but I don't have those numbers. But the reality is that you still have flare-ups, even when you have a perfect diet. And so that means that it's a piece of the puzzle, it's not the whole puzzle. And then I've had cachectic people who are on the verge of anorexia who still have HS. They won't eat because they think the food is the only cause. It's a factor, it's not the only thing. But then we have to rebuild their protein sources. They're draining protein out of their body. They're dropping their blood counts. They can't heal wounds. So that's where the diet becomes negative. So that's why I try to walk that line, let people understand, but all I can do is educate, and then they have to walk that journey of figuring out how food affects them. But you're right, food's got a huge role. What exactly does it do? Here are the general guidelines, and then you have to take it from there. But there are studies going on. We're starting a study at Henry Ford looking at diet and some of the blood tests that you've experienced and those things. But we're looking at it, and so are other groups.
Okay, because that was going to be my next question. I was going to ask when you all are sort of like, when is like diet going to be a clinical trial, or when are they going to create a clinical trial for diet?
So it's a methodology issue right now, Jasmine. So we are so focused on drug development, and it's not a sometimes, and I get this from HS patients, they're so frustrated with the system. They think that people are trying to keep the patients suffering to maybe administer medication. There's a bias in the system, but it's not intentional. But it's because the system is designed to say, complex disease, figure out the exact pathway, give them a drug, keep them the drug, make money for the company. And that's how the system is sustained. Diet is a whole different methodology, because who makes money with diet except for the large food manufacturers? So the milk industry will sponsor something, or they won't sponsor something, the almond company or whatever drug or food you're talking about. But that's not the way HS is going to work. It's going to be a variety of foods and limiting that. So we've had to do internal fundraising. So we have done that. We also have a dietitian who's willing to donate her services. She's been affected in her direct family through HS. And then we were working with a couple of companies that are using diet to improve overall health. And they have some of the more published studies where they can take your bloodstream, look at what foods make your body more inflamed, and we want to see if that makes a difference. And then we have these patient-reported outcomes that have now been validated through the pharmacy-based studies, the pharmaceutical studies, but we can apply this back to diet studies. And now we can say, okay, these are the measures. When people did this diet, this seemed to make a difference. But you have to have a starting point, because right now all we have is saying, Jasmine, try this and count the number of nodules and call me in the morning. That's okay, but you can't aggregate data and analyze it and make better interventions. And we have so many great people throughout our HS community who are working on this, but that's the way we're approaching it. Let's develop a methodology that's sustainable, that ultimately gets into a baseline assumption, and then we modify it and see what happens. And then you rinse and repeat. You just keep doing that. And that's how medicine works. And then we get more and more data, and then all of us can share it. We can discuss it, and then we can kind of come up with our own assessments. But it's going to be an active process and a partnership with our patients. But at the same time, the only reason we're doing diet is because people like you and others brought this up. And so it's your voice. But realize this is really tough, hard work.
Mm-hmm. Absolutely. I think that that's a good segue into the surgical options that are available. At your office, you were talking about phototherapy. And then also, me personally, I got CO2, and you have deroofing and plastic surgery. So can you kind of talk about some of those surgical options and who is the optimal patient to get these surgeries? Because I know, for an example, when I was stage 3, I was a high risk patient to get those surgeries just because of the rate of reoccurrence that might happen after getting the surgery. So can you kind of speak to that for me?
Sure. So there's a couple of different procedural elements that we can do. And so one is an early stage disease. Before you enter into the full-blown stage 2 or 3, where you have the sinus tracts interconnecting, when you have the nodules, you can remove those with laser hair removal. So the hair follicle is a target. And like we talked about, the hair follicle is where the defect is. So if we burn out the hair, suddenly the HS seems to improve. And in about 2/3 of patients, if you treat early enough, in one study, it prevented progression. And then Henry Ford was some of the initial groups that did the initial work, but groups in the Netherlands and Germany and other parts of the United States have done subsequent studies showing that that reduces progression. That's for early stage disease. Deroofing is when you have that first stage, when you have tried diet, hormonal therapy, you've tried treatment with antibiotics for short courses. You don't really want to put somebody on an immunosuppressive yet. And so then if you just deroof it and you remove this gelatinous material, it seems to really improve the lesion and it heals with the scar. So that's a very minor procedure where we numb it up, we make a small nick, and we just kind of open up the center of that sinus tract. And rather than having a tunnel, you heal up with a solid structure. So you're removing the tunnel. It's a localized procedure. So you got laser hair removal for early disease, deroofing for that mid-stage disease. But once you have this interconnected set of sinus tracts in the underarms below the rest of the groin, you just can't expect medical therapy to work. And you've unfortunately developed into a consistent pattern where the inflammation and the scarring will reinforce each other. And it is just such a tremendous inflammatory burden to the patient. And the only thing you can do is take out that inflammatory set of cells, and then hopefully it'll heal with a flat scar. The vast majority, I think it's like 90% of our patients have CO2 surgery. At the end of 6 months, they are moderately satisfied. But at the end of the year, almost all of them repeat it. About 91%, I think that's the number that we have in our practices at Henry Ford. But my first 2 or 3 months, they hate my guts. 6 months, their parents don't like me. By 9 months to a year, they're handling it a little bit better. But it's a tough surgery. Now, plastic surgery is done by our advanced plastic surgery team. Dr. Siddiqui up in our department, in our hospital actually, has done a lot, along with Stephanie Goldberg in Virginia, but a lot of other surgeons who are very good, Dr. Orgel at Boston. But in that situation, you have such a mass of these sinus tracts going all the way down to muscle, you have to cut that whole thing out. But you also have to have a reconstructive expert who can rebuild the tissue, or a wound healing expert who can help you, do the healing for that. And then lastly, there are some new technologies to prevent HS using phototherapy, as you described, Jasmine. That's for early stage disease. And there's also a late stage disease where they're using phototherapy to help wounds heal in. So when people have wounds that split open, we can do another type of laser. And then you can also have another type of phototherapy. But where does it fit in? It depends on what stage of disease you have. The cutting technologies such as CO2 laser, cold steel excision is for advanced stage 3 HS you cannot manage. Now, if you do that, you can move people from the stage 3 where they're constantly draining, constantly in pain, to a stage 1 where they have a scar, is disfiguring, but it's not constantly draining, it's not constantly in pain. And then you still have to maintain yourself with medical therapy, because from what we know, if you end up with that stage disease, the only place that you can really definitely heal and put people into remission are the underarms. Everywhere else, if you have lesions anywhere else, you're gonna have to probably go on systemic therapy to suppress the new nodules. So it's part of the package, like everything we talked about, like diet, like short course of antibiotics, like anti-antigen therapy. And this is one of those things that can help you. And then also the biologics we'll talk about in a little bit.
Mm-hmm. So can you speak to the treatments? Because you talked about some of the treatment options that are developing outside of surgery. So the biologics, can you talk about that?
Sure. And so we'll get some time for the questions in the panel, right? I just want to make sure I get those.
Yeah.
Okay. So I'm sure that was biologics and what was the other therapy you wanted to cover?
Just biologics. So yeah.
So biologics are some of the biggest advances we've had in medicine for the past few years. they have a price tag that is astronomical, and people get stuck on that. But let's separate ourselves out from that. What are biologics? They're molecules that change the biologic function of tissue. So they're often injections because they're too big to go through the GI tract. So they're larger molecules. They have to be injected either through your skin into your subcutaneous tissue, your fatty tissue, or through an IV. But they're able to target different parts of your body's immune system to turn off switches. So one example I give people, and maybe it's not a perfect analogy, but it's similar. If you think about your circuit breaker, you can either turn off the whole circuit that's shutting down the entire immune system with prednisone, or you can go to the exact circuit that's causing a problem, flip that switch. But basically, different biologics have different effects. Some biologics take out the entire panel, some are very selective. With HS, we're getting better and better at selecting those. And there's been some huge advances in that. Now, initially, a lot of drugs for HS were just repurposed drugs for psoriasis, for arthritis, rheumatoid arthritis, for other conditions. But now we're getting HS-specific development because people have seen the burden of the disease. And the economic burden, economic research in HS is critical because it shows the burden of the disease in people. Your narratives, this presentation you're doing is so critical because I can assure you that there's somebody who's a decision maker whose kid or themselves or their spouse has HS, and they love has HS, or they have it themselves. And these biologics advance actually because of a personal story. Somebody in somebody's family had HS, and then they start looking at the research. But if you just selectively target your immune system, you can really improve it. The different biologics will be coming in different stages of disease. Which ones work for early stage disease? Which ones work for late stage disease? And which ones work for people who have arthritis with their HS? But again, they're selective targets. The only one that's approved so far is a product called adalimumab. It goes by the brand name Humira as a way of a conflict of interest. The HS Foundation gets funding from AbbVie, which is a parent company that makes Humira. I personally, to my knowledge, have not received any funding from them, but I think you should know that the foundation I represent is funded by them. Mm-hmm. And that's one of the first FDA-approved agents. It was an advance. It was the first thing we had. Is it a perfect drug? It's not, but for some people, it's dramatic. And my guess in our practice is it's about a quarter to a third of patients have a dramatic improvement, which can be life-changing. But a lot of people fail Humira, and so if they fail that, then I end up using another medication called infliximab. And then the HS Foundation has worked with the Canadian HS Foundation, put together a set of guidelines that's publicly available. If you go to the HS Foundation website, you can list all the biologics and then which ones we recommend and which ones have FDA approval. And then there's also an article that Alexis Lyons, one of my fellows who's just finished, Dr. Lyons just finished a summary of all the emerging treatments. But almost every HS patient can expect to be exposed and offered some kind of biologic. It is going to really help you, but please don't forget the fundamentals. You got to take care of your health. You got to manage your diet. You got to keep an eye on your weight. You got to make sure that you avoid all the other comorbidities, and then you can talk about these biologic agents.
With that being said, so can you touch a little bit on that before we get into the Q&A about weight? A lot of patients at least I've seen in support groups, they have found a lot of physicians saying that the reason they have HS is because they're fat or because they are overweight. Can you speak to how true that is and to what extent?
Well, what's true there is a doctor totally missed the way they should engage with the patient. If you talk about weight as a first-time conversation with an HS patient, you got it wrong. So weight does not drive HS. It's a variable among the many variables we talked about, but also having HS can also drive the weight up because you can't move. And then, but that connection between diet and HS is related to weight. So you can't discount the fact that weight's a factor. Is it the dominant factor? No. So if somebody starts off with weight as the first thing you do to manage your HS, probably, with all due respect to the doctors, and I love so many doctors, the doctors in the HS Foundation, my friends who work in HS, the best doctors I've ever met. But there are some really bad healthcare providers that miss this. So again, diet should not be the first conversation. It's one of the conversations, but it is not the primary driver of HS.
Mm-hmm. Okay. And just one more quick question. How do patients, or what would you suggest when patients come against physicians who say things like that to them, or don't necessarily give them the best information, or can't provide them with the help that they need in the office for treatment and just diagnosis and things like that?
So we have a support group that's affiliated with HS Foundation, Hope for HS, which you've been a supporter of, that's been one of the best things that ever happened to me as a doctor, because there's times I have offended people and that feedback comes from them. So one of the things I would encourage people to do is find a doctor they connect with, because this is going to be a journey, and you can do it together. But the support groups are so helpful. They're so knowledgeable, many of them, and they really get into the science. And the reality is that there's so much knowledge out there. There's some really caring dermatologists and physicians who do love their patients, but you can't know everything. So a good dermatologist who doesn't know a lot about HS will refer you to the right person who can help you. But if they start off with talking about weight or odor or other issues, they don't really know what they're talking about. The other thing is, watch your mental health. Unfortunately, patients with HS can have fully functioning, very, very happy lives, but they also have one of the highest rates of depression and unfortunately suicide in all diseases in dermatology. And we deal with a lot of diseases that affect the mental health of our patients. So there's a talk that Athena, one of the patients that worked with the foundations, gave at the American Academy of Dermatology. There wasn't a dry eye in the house, but it talked about how the first surgeon she met, or one of the first surgeons she met, told her she was dirty and that's why she had HS. So all she did for 3 years was scrub and scrub and scrub, and didn't want to have any social engagements, stayed away from her loved ones or her family. You know, that's an example of medicine doing harm to somebody.
Yeah.
So if somebody tells you that you did the HS to yourself, you should probably consider disputing the copay. Don't not do that, because that might be illegal. But you should challenge that doctor, and then you should go back to your support group. And there's a support group in almost every state in the country now, or at least affiliated with every state, and reach back out to find people who deeply care about you. At the same time, be forgiving to your doctors. We are under so much pressure nowadays. You know, I've been working 70, 80 hours a week with all these COVID issues. We do love you guys. This is why we do this. But give them gel feedback. Give them some information that you found from the support group. So you did your own research, and it's a joint journey, because there's intervention that you can bring up. Jasmine, you brought so many great treatments over the years. We always kind of talk about them and we try them together, and you do it and you teach me something. Mm-hmm. But at the same time, if they're not willing to listen to you and they're not up to date in the most recent research, you can find somebody. There's so many HS doctors. And I encourage you to go to the HS Foundation specialty website. It lists all the specialty clinics. Start off, it's not perfect, but we try to vet every single person. Every single person on that website has been vetted by somebody on the board of the foundation. We've either seen them come to our meetings, or we've mentored them, or we know them. And if you have a bad experience, let Hope for HS know, or let us know, and we'll try to work with them. But again, don't start off with somebody who's going to walk you through a negative alley where they blame you. If they blame you for your HS, find somebody else.
Absolutely. And I think that brings up another great point, which is at the end of this summit, we are going to put together a packet that we're going to distribute to all the attendees. And it's going to have a list of resources because there are so many individuals who are having trouble finding physicians that specialize in HS so that they can get the diagnosis and treatment that they need. So that is one of our goals. And I will include the HS Foundation within that, and that specific resource that you were speaking about for the specialists, because that's important for patients to be able to empower themselves and reach out to physicians who can actually help them rather than perpetuating in a cycle of not getting the treatment and help that they need. So I really appreciate this whole conversation, because I've learned a lot today that I didn't know about, especially with biologics. And I know that there are some patients who have been educated from you explaining about treatment, to explaining about the different stages of HS, and then understanding how diet affects our bodies and as HS patients. So I really thank you so much for diving into that with us.
Thank you, Jasmine. You're a special lady. And give your mom and dad my regards. I love it.
Absolutely. We do have a few questions that we want to get to. So Steph is asking, how long should they be on antibiotics? They've been on them for a while now and they still get flares, but they're concerned with their body getting too acclimated with it.
So the majority of the dermatology and the HS community, it's not just dermatologists, but dermatologists and other HS feel that antibiotics are a bridge to the next treatment. So you use it when you have an acute flare-up. Now, you can go up to 12 weeks, so it's longer than most courses, but there has to be a limit. and the French have done a lot of work. Dr. Nassif and Dr. Joanne Lambert, who have done incredible work that have, really inspired us and helped so many of our patients. But they use antibiotics a little bit longer based upon the cultures that they get. In our practice, we bridge it. So we do want to talk about your overall well-being. We try to calm you down first with antibiotics, and then we say, well, what can we do with lifestyle? We encourage you to kind of experiment in your own self within certain domains of health. And then we also will talk about what else can we do. So if you have a sinus tract, we have to remove that somehow. That will reduce the need of antibiotics. If you are getting nodules with your monthly cycle, then spironolactone, an anti-androgen that you can take for a long time, is another thing that you can take for females. For males, we can try other medications like finasteride. If your blood sugar is running high, or if you're leaning towards a type 2 diabetic state, things like metformin, which is a medication to reduce insulin resistance, can also be used. And so you have to find that long-term option. And then for a certain percentage of patients, biologics can be a very good option because we have lots of data using biologics for long periods of time, very carefully, of course, but you can use those. But antibiotics have to have a bridge. Now, sometimes people have such a great response to antibiotics, they get on the bridge, but they don't know where to get off in the next exit. There has to be an exit. If you don't have an exit strategy, at least for the first 2-3 weeks of your visits with your dermatologist, you should encourage them to do that. And if they don't say, well, I don't know what else to do, go online to the HS Foundation, download the HS guidelines that we've published. It's available to you. And even if you don't understand it, give it to your doctor saying, I've got 14 other options you have here. Like, oh, let's try that. And then don't forget, there's lots of clinical research, lots of new options coming up. But antibiotics are a bridge. They are not the destination.
Mm-hmm. That's great. The next question from an anonymous attendee, they say, hi, Jasmine and Dr. Hamzavi. I have stage 3 HS. My diet is up and down, but I have cut out bread for a week. I hope to cut out others and see how it goes. I get flare-ups before, during, and sometimes after my periods. Is there anything I can do? I stopped taking antibiotics as it was just too much. And I think that was, I'm going to add a little bit to this because I think she's talking about, or they're talking about this, which is hormones. Like, how do hormones play a part in the development or persistence of HS?
Tremendous role with HS. So the rates of HS, like we talked about before, are very low in children. They're present, but they tend to be more in genetic cohorts, meaning that a third of people with HS have family members. So that tends to be the group that gets it. Boys and girls, same rates. The minute puberty hits, women become 2/3 of the population. The other thing is women will often describe that they flare. And then we just did a large study with Jenny Sao and Vivian Shi and Alexis Lyons, and we looked at, and Angelica Peacock and a couple other people, we looked at pregnancy. And pregnancy, for the most part, makes HS worse. So we have so many intermediate data points to say that hormones make this worse. There's also documented data showing that spironolactone, which is an anti-androgen, works with HS. We also have decades of literature showing that acne, which isn't exactly the same, but has similar features to HS, responds to hormonal therapy, oral contraceptive type pills. So birth control can maybe help with HS, but definitely spironolactone, which is an anti-androgen, does help. So I would really start to look at that as an option and see if you can do that. Again, diet's got a role, but don't hang your hat on diet alone. Find the conditions, the options that will help you with your flares, and hormones are a factor there.
Mm-hmm. Absolutely. Another anonymous attendee asked, any suggestions for getting laser hair removal covered by insurance? We were kind of talking about yesterday how when you're getting like plastic surgery, CO2, things of that nature, insurance agencies often classify that as cosmetic, and so they don't cover the procedure all of the time. So could you speak to that if you can?
Sure. So it's been a real struggle trying to get that those conditions covered. And part of this, it's a system that we have. So the way it works is that the insurance companies will seek FDA approval before they'll cover a treatment. And so a company has to put a couple $1 million into doing studies to show that it works to get the FDA approval. Now, with laser hair removal, there are at least 3 or 4 control studies, which is one of the highest levels of studies, showing that it works. And then the foundation has labeled as a level B, not the best option, like a biologic has lots of great documentation that works. It's level B. And so you can take some of the documents and file a complaint with your insurance company, or at least an appeal. The other thing is being part of Hope for HS or other support groups, writing letters to your insurance companies to get it covered is very helpful. And even plans that have official policies not to cover laser hair removal will change it if you can submit this documentation. And again, one of the best documents is the HS Foundation's guidelines. You know, Dr. Syed and Dr. Ali Khan spearheaded that, but Dr. Syed from the University of North Carolina and Ali Khan from California did a lot of work with this, and they organized all of us to say, how do you benchmark laser hair removal for everything else? The other thing is making the argument to your insurance company. It costs like $150, $200 per session for laser hair removal. That's much cheaper than most antibiotics and is way cheaper than a biologic. And so making that argument, it'll change over time, but I think it's going to take a full FDA study to do that. But the challenge we have is that then it's just going to jack up the cost for everybody else. So we're trying to walk that line, but patient advocacy can do that. And we are working on appeal letters, and there's a reimbursement committee within the HS Foundation. We hope to have appeal letters on the foundation next year or so, and you can also download those and give it to your doctor and say, can you sign this, and send it with your letterhead, and that also might help you. But petitioning the insurance companies, all of you have the right to do that. Letting them know that you have HS, giving the guidelines, can help you get coverage for that. In our area, HAP, one of the insurance companies that's affiliated with Henry Ford, covers it almost completely. And some of the other insurance companies are starting to cover it, but still not on board.
Mm-hmm. Absolutely. Do you have time for a few more questions?
Sure.
I just want to make sure that I'm respecting the time that you have.
I wanted to make sure there's a couple on the chat group.
Mm-hmm.
So from Antonio, Steph, Nikemka.
Yeah, go ahead.
So I'm just going to kind of make sure I cover these. Birth control can make HS worse, absolutely. And about a third of people get worse. And there's also a third of people get better in pregnancy. So again, you have to know your body. The first question you ask is if you flare up with your cycle, you probably have the hormonally mediated HS, which gets worse with your cycle. Birth control. You can use spironolactone if you're concerned about weight gain with birth control. There's also another product called Yasmin, which has an ingredient called drospirenone, which is a much lower chance of causing birth or weight gain. So there's forms of birth control that do not cause weight gain. There's forms of anti-androgens that have nothing to do with birth control that can help you. So that's the birth control questions. Dr. Syed is amazing, absolutely. Dr. Huggins is amazing, absolutely, from Detroit and North Carolina. Odor. Odor is something that we're really struggling with, but there are a set of antibiotics that seem to help with odor because the odor seems to be driven by certain bacteria. So if you have a lot of odor with your HS, you might want to get a culture done by your doctor and see if a specific antibiotic called metronidazole would be an option for you. And that might be helpful. You can also sometimes use drying agents, and there's a bunch of companies that make these that go on as gels and become powders that can also be helpful. But antibiotics can be helpful. And lastly, laser hair removal can help to help mitigate the odor. And then biologics, in extreme cases, we have tremendous thick purulent drainage can also be helpful. My first appointment with my first derm told me I was overweight and insinuated I had it because of that. Again, if you want to get me upset, I'm a pretty calm guy. That will tick me off. So I agree with you. And it's a horrible way to engage people. Stem cell research, go ahead.
Oh, no, I'm sorry. I was just going to say, somebody mentioned stem cell research too.
Yep, stem cell research is an option, but we have to figure out what the stem cell defect is. So the stem cells are dependent on the type of cell line you're talking about. Is it an immune cell line? Is it a lymphocyte, a neutrophil? Those are targets. Is it a fibroblast, that cell that helps rebuild scar tissue after you've had a wound? But yes, we could use those, but we'll have to figure out where the defect is, how do we place a stem cell there, and then see what it does to everything else. But yes, that's something that has helped. Dairy, there's a few reports of dairy being making HS worse. So again, I would put that on a list of foods that you might want to consider reducing. Not as high as a high carbohydrate, high glycemic index foods, but yes, dairy may be a factor in some people.
Mm-hmm. So anything that turns into sugar is really will aggravate HS essentially.
From what we know today, in a large subgroup, not in everybody, but in a large subgroup, yes.
Okay.
And that's what the dietary therapy is going to, hopefully the study will help us figure out who benefits from what type of diet.
Absolutely. Okay, you talked about spironolactone, so I'm going to skip this anonymous question, let me see. opinion, what does... Okay, you explained what spironolactone does, because this is what that individual is asking. Okay, so the other question, can laser hair removal be done on someone with albinism? I have a very fair skin, light blonde hair, and the hair under my arms and groin is really light in color. The reason I'm asking is I was told about a year ago it couldn't be done. Also, do you have any recommendations for dermatologists in New Jersey, New York City area?
So, so first of all, laser hair removal can be done. And I think this is a great example of I believe, let me make a comment on our society. So when you take care of one group of population in our society, you help everybody else. So we had developed laser hair removal initially for people of African descent, because that was our majority of our population. Started using it. And then we had some light-skinned patients come in, and they were enrolled in a trial. And everything we learned about laser hair removal, the lack of pigment in the hair follicle suggests it wouldn't work. But in light-skinned patients, blonde patients, patients with albinism, we've treated them and they respond, in many cases, laser hair removal. In fact, some of them, especially in the breast hair, do even better. And that's partly because we believe that the hemoglobin structures in the blood vessels is absorbing a portion of laser light. So there's something about heating that's a factor. So I would ask the people or the physicians who don't want to treat you to read the original papers from the dermatologic surgery journals, as well as the JAD and the JAMA articles that we published many years ago. And you'll see about a third of people were Caucasian. And many of my patients have gone to long-term remissions. So yes, the theory doesn't match up. The actual evidence of people suggests that light-skinned patients are not inhibited. And again, that goes back to a treatment that was developed for mostly people of African descent, help people of different skin types. So yes, you can. That was the first question. Was another question with that one?
No, that was the only question. Do you have time for maybe two more questions?
Or yeah, that'd be great. Yeah.
Two more. Okay. What are your recommendations for scarring as far as reducing the appearance of them?
So we are really working. The one thing about dermatology is that we have a whole cosmetic group, and the cosmetic groups always have a little guilt, and they're great people, but they always want to help out as medical dermatologists. So they're really helping us out with some of the scar resurfacing technologies. So basically, when people get scars after burns, they have a lot of new technology called fractionated laser resurfacing. So for some of the scarring that occurs, that's an option. We're also doing a lot of great work with keloids. My chairman and my friend at Henry Ford, Dr. David Ozog, does a lot of great work with scarring, along with lots of other people throughout the country. So there are other modalities using these different ingredients that modify these cells called fibroblasts. So Dr. Donald Glass up at UT Southwestern is doing a lot of great work in that area. So right now, what do we have? We have laser resurfacing as one option for patients who have elevated scars. And then for the discoloration, you can use a device called a Q-switch laser that we're using anecdotally, not a lot of great evidence to help manage it. Are we great with scarring? No. We still want to keep focusing on controlling the disease, but we have a whole group that's ready to go for scarring and needs to do a lot of work. But when you bring it up to us, we'll keep looking at it. My dream is scarring is my biggest complaint, and I will really work with everybody. Maybe I'll retire by that time, but there are people working on it.
Absolutely. The last question, and I do want to, before we get into the last question, if we did not get to your question today, attendees, please feel free to email Rhonda, which is at the top of the chat bubble, and she will help to field your questions to Dr. Hamzavi, because we want to make sure that everything you're asking can get answered. So if we didn't get to your question, please make sure you copy it and put it in an email to send to Rhonda, which is Dr. Hamzavi's assistant. Getting into our last question by another anonymous attendee, they've noticed that getting sun actually clears up their nodules, even if they are covered under light cotton. Is sun a good treatment for HS?
So sun has been shown to be a good treatment for a condition called acne keloidalis nuclei, which is a condition that occurs in people who have curlier hair, more men, they get these bumps. And so some of the cells that are present, some of the findings are similar to HS patients. So there are reports of UV and visible light helping those conditions. So there are reports of that. Large scale studies, do we know how to use it? We don't. But I've heard that before. Heat, people often describe as making the HS worse, but sun may help. Jasmine, do you mind if I just go through a couple of questions from people?
Absolutely. Yeah, I didn't know how much time you have, so I wanted to make sure I respected your time and things like that. So yeah, go ahead.
Yeah, I'm sure I'm running late for something, but I really want to get these. So doxycycline, there's a question with doxycycline. We do use that in early stage HS. It's a good antibiotic. Doesn't work in everybody, but it's a good one to start off with. Ertapenem. So ertapenem works wonderfully. It's probably the best treatment of anything we have in HS. The challenge is that you can only be on it for 6 to 12 weeks. It's an IV antibiotics. It's for the severe variation of HS. You have to have a bridge ertapenem. You have to have a destination. So make sure you talk to your dermatologist about what you want to do after the ertapenem. But we use it all the time. The last question was the dosing of the two antibiotics. Specifically, I don't see that question here anymore, but the dose I saw, 300 milligrams twice a day for one of them, is fine. The doses that we use for HS are much, much higher because we have to eradicate the bacteria, not because of the pathology and it's eating up your body, it's because your immune system is almost allergic to it. So you have to use higher doses for longer periods of time. That's commonly done. Not well taught to everybody, but it is done. Immune system and COVID, great question. So we actually, Dr. Haley Nayak and others have set up an entire system to track what happened to HS patients who are on immunosuppressant as well as HS patients in general who got COVID. In our population, thank God, all of my patients who got COVID who had HS all survived and are all healing fine. Thank God. Some of them were patients I've known for so many years, and there's one specifically that just got really sick, but they're doing great. But so far we don't see anything yet. There's a great COVID session on the HS Foundation website. So if you want to hear it, ran by Dr. Hadar Laptop and Raja Sivamani, and everybody contributed to it. So take a look at that. And then somebody asked about what product do we suggest that will go on as a gel and turn into a powder. So I never liked the branding of this, and I might have gotten it wrong, but I think it's called Thunderballs. I apologize for the name, but it's used for male athletes and older men. And it goes on as a gel and it becomes a powder. I'll make sure I get the name of the company. I'll send it out to Jasmine and so she can post it.
I want to thank you so much because this has been very informative. And I was looking forward to this because you're one of my favorite doctors just in general, but also because I know that a lot of people were looking forward to hearing from you and just understanding their diagnosis a little bit better. So thank you for helping us to meet that mission and accomplish that today.
Well, Jasmine, I've always told you, you're a beautiful soul in a beautiful body, and you have made such a difference to people. But I love you taking this platform. We need a spokesperson for HS, and I hope you're one of them. So thank you for all that you're doing. And I'm sorry I can stay longer, but thank you for giving me the opportunity to spend time with you today.
Absolutely. Thank you so much.